October is Breast Cancer Awareness Month, and Black women have a 40% higher breast cancer death rate compared to white women. That's according to the American Cancer Society. Breast cancer is a leading cause of cancer-related deaths for Black women. Joining us this morning to talk about the disparity when it comes to health care is Dr. Tarsha Jones, an associate professor at Florida Atlantic University. Thank you so much for being with us, Doctor. Wow, some very eye-opening and startling statistics when it comes to minority women.
Well, thank you so much for having me today. I'm really thrilled to be here with you. And so first, I'd just like to talk about breast cancer in general.
Okay.
Breast cancer is really an urgent public health issue that deserves our attention. Nearly 300,000 women are diagnosed with invasive breast cancer each year, and nearly 40,000 women are expected to die from breast cancer. And while 83% of the cases, invasive cases, occur in women over the age of 50, we know that young women can and do get breast cancer. So we see that 4% of the cases occur in women under the age of 40, and 13% of the cases occur in women ages 40 to 49. And certainly these statistics are staggering, but they are also compounded by racial and ethnic disparities. And we see an unequal gap, particularly in the mortality rates. As you mentioned, 40% higher death rate for Black women.
Why do you think that is?
So that's a very interesting question. I think, there are multiple factors contributing to this disparity. It's a combination of biological factors, more aggressive cancers that we see in Black women, particularly triple negative breast cancers. We see younger age at diagnosis for Black women. We see pathogenic variants or mutations as well. Certainly advanced stage cancers, but there are these social factors as well that's playing a role in these disparities. Certainly poverty, access to healthcare services, access to mammography screening, which is so critical and life-saving. So that's why we really need to move towards health equity. And we do that by creating a greater spotlight on populations that experience disparities, such as Black women, but also Hispanic Latina women who also are diagnosed at younger ages with breast cancer, more advanced stage cancers. And what we're seeing is that breast cancer is the leading cause of death for both Black and Hispanic Latina women.
And so, when you do this research and you find these statistics and you determine that this is happening, do you feel like we're doing anything to make it better, to make this healthcare more accessible?
Absolutely. I think we have made tremendous progress in improving access to screenings, early detection, greater outreach to underserved populations. But because of the statistics that we discussed, there's a lot more that can be done. And certainly we're highlighting one of the studies that we conducted at Florida Atlantic University in the College of Nursing. And we found that there are barriers to mammography screening, that women are still having a hard time getting a life-saving mammogram. Now, certainly some of those barriers are perceived barriers, so it's based on their beliefs, whether or not they're really going to be able to get a free mammogram, or is it going to be inconvenient for me, or even is a mammogram painful?
Sure.
Just these beliefs that they have, or am I going to be discriminated against? And so at our FAU Community Health Center, we have a very unique patient navigator program that's actually helping to mitigate some of these barriers and disparities.
And that's what I was going to say, that if you're out there watching right now and you think, oh, I can't afford one, this isn't for me, I'll be okay, there is no reason that you can't go out there and find a free mammogram or someone who can help you find an affordable mammogram that's not going to take up too much of your time, and we can find that at FAU. I know you guys have a lot of resources. Thank you for all you do, Doctor, all of your research. And if you would like more information on this study and what it means, and also how you can learn how to be screened for breast cancer, we've got information on our website. Just search breast cancer. Thank you so much for being here.
Thank you
Great
for
information.
having me, Erin.
Vanessa?